Hello, I'm Dr. Needu. Today I'm going to discuss about one of the most important topic in this ECG series, that is ECG interpretation. If you find any difficulty in reading an ECG paper, or if you get confused while get an ECG paper, then this video is for you. Watch the full video and finally you will be able to understand and interpret ECG very easily. So let's start. So when you receive an ECG paper, first check for the heart rate. That is very important. So in an ECG paper, you have many small squares and many large squares. So one small square means 0.04 second and 5 small square constitute a large square. So one large square is 0.20 second. So 5 large square means 1 second. You should be thorough in this time duration. Then you will be able to read ECG very properly. So coming to the heart rate, if the rhythm is regular, then we can apply 300 rule. 300 rule means you have to count number of large square in between two R waves. For example, if it is 4, then you have to do 300 divided by 4. That is 75 beats per minute. This is 300 rule. And this is one of the easiest method which we can use during bedside, and it can be used during exams, etc. Next rule is, which is the most accurate method, that is 1500 rule. So if the rhythm is regular, then you have to count small squares between two R waves. For example, if it is 20 small square, then 1500 divided by 20. Then you will get 75 beats per minute. So these are the methods which we can apply if the rhythm is regular, that is 300 rule or 1500 rule. If the rhythm is irregular, then we will go for 6-second method. That is, you have to count number of R waves in 6 seconds. For example, you will get 8 QRS complex in 6 seconds. Then 8 into multiplied it by 10, that is 80. So this is applicable if it in case the rhythm is irregular. Okay, hope you understand heart rate. Next is rhythm. Rhythm means how we can find a particular ECG is having a normal rhythm. That is, we have to check 3 things. First thing is that there is an equal spacing between two RR interval. If there is an equal spacing, then the rhythm is regular. If the spacing is not equal, then it is an irregular rhythm. Next is, you have to check whether there is P wave before every QRS. If there is a P wave, a regular rhythm. If there is no P wave, then followed by a QRS complex, then it is an irregular rhythm. Finally, we have to check for the PR interval. If the PR interval is same in each beat, then it is a regular rhythm. And if the PR interval is not same, then it is a irregular rhythm. This is the method in which we can find a rhythm is regular or not. If it is an irregular rhythm, again it is of 2 types: irregularly regular and irregularly irregular. Irregularly regular means that the rhythm is irregular, still it follows a repeating pattern. For example, in sinus arrhythmia. And irregularly irregular means rhythm is irregular and also it follows no patterns at all. That is atrial fibrillation. That is an example for irregularly irregular rhythm. So in this manner, we can find whether the rhythm is regular or not. This is a second point which we have to keep in mind. Next is cardiac axis. So okay, you can consider my right hand as lead 1 and my left hand as AVS. Then if two hands are if lead 1 and AVS is positive, then it is a normal cardiac axis. If lead 1 is negative and AVF is positive, that means 1 is right hand, so right axis deviation. If my left hand, that is AVF, is negative and lead 1 is positive, that is my left hand, so you will get a left axis deviation. So this is an easy method to find a cardiac axis. So next we have to check for the waves and intervals. So you have to check the P wave, the QRS complex, then PR interval, QT interval, ST segment, T wave, etc. And I have taken a detailed video regarding these waves and intervals in the part 2 of ECG series. If you haven't watched that video, please go and watch that video, and I will mention the link here. So you will get a thorough idea about the ECG waves and intervals, how to check when you get an ECG paper. So these are the important things that you have to keep in mind. So once again, when you get a ECG paper, you have to check for heart rate, rhythm, cardiac access, then the ECG waves and intervals, that is P wave, QRS complex, T wave, then the interval, PR interval, QT interval, then ST segment. Most importantly, you have to check for the ST elevation and ST depression. So that's all about the ECG interpretation. If you find my video useful and if you understand my video, please do subscribe and share my video. Thank you.